The cartilage of the knee, what I will call the cartilage and what the general public will call the cartilage, is sometimes referred to as a meniscus. So if we say meniscus, we mean cartilage. A common scenario would be an athlete with a perfectly normal knee who suddenly has a sudden twist doing his sport and gets acute pain, typically over the inner aspect of the knee, the medial aspect of the knee, the inside of the knee joint. And that would be a reflection of the medial meniscus, the inner cartilage tearing. At the other extreme, you have people who are a little bit older, where there might be a tiny bit of degeneration, there's a tiny bit of arthritis in the knee, not very much to write home about, who have a lesser injury and who come in with a grumble, often on the inside of the knee again, or perhaps at the back of the inside of the knee. Both of these are reflections of cartilage tears, they're just torn in different ways. They may be handled totally differently. If you take the younger individual who has the perfectly good knee but just a cartilage tear, they may well end up with an MRI scan as evidence to help that diagnosis, but then ultimately lead on to an arthroscopy. And there the surgeon will have basically two choices. Am I going to repair this? Am I going to remove it? Now, if you can do it, then repairing a meniscus is a good thing to do. But you need to be fairly sure the thing's going to heal. And if you look at a meniscus, a cartilage, the blood supply comes in from the periphery. If you get a tear near to the blood supply, then you can probably repair it quite well because the blood supply will help healing. If you have, and that's called a white on red tear. If you have got a tear within the body of the cartilage, the meniscus itself, where there's very little blood supply, if any at all, what we call a white on white, then repair is probably not going to work, and so you may have to remove that little bit. If you go the other extreme with the degenerate medial meniscal tear, which sounds terrible, but it's not I don't mean a total degeneration, I simply mean a tear where there's a little bit of arthritis has crept in as well, then probably you're not going to repair that particular meniscus. You may remove it, but you never really remove the whole meniscus. You tend just to remove the torn portion because there's no requirement to remove everything. There is always the opportunity of just leaving a meniscus alone, leave a meniscal tear alone and see what happens. I don't know if I'm actually allowed to say this. I am living evidence of a meniscal tear that's been left. It was torn on the north face of Everest in 1984 and I haven't had it dealt with since. So the presence of a meniscal tear is not an indication for surgery. It's the presence of the symptoms related to the meniscal tear. Which implies surgery. So one would be forgiven, perhaps not with a professional athlete where you have to get your skates on to deal with them, but you would be forgiven for saying to a patient, yeah, I see you have a painful knee, why not go to your physiotherapist, see how you do, come back and see me in 6 weeks, 8 weeks, and then we can take it from there. Full fitness after a meniscal surgery is longer than you think. The arthroscopic meniscectomy, the keyhole procedure, is all over and done with, done and dusted within probably a few hours. You're in and out in a day. Then at that point, treatment varies. Some surgeons, and I'm an example of that, will put patients on crutches for a short period, simply just to slow them down, nothing more than that. It's an acknowledgement that however well you may do an operation, the knee just gets a little bit irritated. You often find, I think, with the physiotherapy side, that actually the physiotherapist gets most benefit from the patient, not immediately, but a few days later. And so you just need time to let these people settle down. And so from a personal viewpoint, I will be saying to a patient, you're going to take at least 2 weeks off work after I've done your arthroscopic meniscectomy, and by all means try and play sport, but don't expect very much out of that knee for 3 or 4 months. And certainly if you're talking about contact sports where people are really going to thump into you very hard indeed, it could be 6 months or more before that you are happy with that knee. You may outwardly appear to be fine, but inwardly you know that knee is still not 100%.